What's up, guys? John here from Titan, and today I want to talk to you about things that could be possibly ruining your testosterone. That's right, day in and day out, you might be damaging those levels or lowering your testosterone levels and not even know it. So let's talk about some of the most common things that you could be doing to be damaging your testosterone levels. One, things we eat. Everything you're intaking in your body, we are what we eat. Remember that saying? That saying is so true. And you could be eating things day in and day out that could be lowering your testosterone levels or not be putting them in a good place. That's one. The second one, talk about sleep. Sleep is so vital for day in and day out activity, the way you feel, your mood, and yes, it can affect your testosterone levels if you're not getting enough sleep. So make sure you're trying to prioritize 7 to 8 hours of sleep to make sure your testosterone levels and you're functioning properly day in and day out. 3, medications you may be taking. This could be narcotics or painkillers. This could be depression medication. This can also be hair loss medication too as well. All of these things can be damaging or lowering your testosterone levels. So make sure that you're looking at the side effects from these medications to know what you're really in for, because some of these medications could possibly go away. Even depression medications. Now, there are people out there that legitimately need depression medications, but some of those people may be put on depression medications because they had low testosterone levels, and that could possibly cause depression. And a medical provider did a blood test, but it just went by the symptoms of what the patient said and automatically put them on this medication, and this is damaging them day in and day out. Next one, activity. If you're inactive all the time and sitting on the couch all the time, your body is being useless. Our bodies were not meant for that. Our bodies were meant to be active. They were meant to go out, hunt, right? See, feel, touch, experiment, everything that's going on in the world. They're not there just to sit and be inactive. And by sitting and being inactive, think about a car or anything else that is inactive. After sitting there for so long, it's not going to run as good. You want to constantly be running your body and being active so that your body is performing and it's working like it should, okay? The next thing after that, when we talk about this, we talk about how testosterone levels can be lowered by head trauma, okay? That's another one, day in and day out. So if you're getting a lot of hits to the head, okay, you might be experiencing low testosterone levels because of it. TBIs, traumatic brain injury. This happens to so many soldiers out there or other people out there. And usually what happens is a pituitary gets wrecked or something happens and their body starts not producing testosterone or like it should. This will also cause lower levels of testosterone in the body. Okay, next one, our environment and what we're putting on our bodies. So every day you're going out into chemical warfare, whether you know it or not. You're like, John, what are you talking about? I go outside and I breathe fine. Yeah, you're breathing fine, but think about everything that's in the air, all the toxins are in the environment, everything you're breathing in. Microplastics are actually in our bloodstream. They've confirmed this, okay? This is affecting our body in so many different ways, and we really don't even know. We are truly an experiment walking around with all the other things that are around us and what we're intaking. After that, what we're putting on our body. There are different chemicals you're putting on your body every single day, and I do too, so I'm right there with you guys. So deodorants, lotions, sunscreen. You're saying sunscreen, but I have to wear sunscreen. I live in Florida. I need it all burned. There are some sunscreens out there that have carcinogenics in them. Now they're starting to take them out of the stores because they're starting to find this out. But still, a lot of people have used these things for so long, or even deodorants. That's right, I put on deodorant too because I don't want to stink. But I'm telling you guys, there's different chemicals in there that could be endocrine disrupting chemicals, EDCs. And this could be affecting your hormone levels and particularly your testosterone levels. So these are just some of the common things you're dealing with day in and day out that could be ruining or lowering your testosterone levels. And who wants that, right? Nobody does. I'd like to keep my natural testosterone levels for as long as I possibly can. Now my natural testosterone levels bottomed out probably about 31, 32 years old, where they were not optimal and they were really at the lower end. So I've been on testosterone replacement therapy, hormone replacement therapy for that long, now 41 years old. But I can tell you this, I feel better than ever. I definitely look at what I eat, how much rest I'm doing. I try not to take in any medications that are going to be disrupting my hormones or lowering those levels too as well. but I'm also substituting and implementing testosterone in my body. So I don't really have to worry about it getting low because I have it covered in my body. But people out there that are not on hormone replacement therapy or don't want to start just yet, you really need to look at these other factors, right? Get those in check, and maybe your levels can stay naturally higher for a longer period of time, okay? So it's up to you guys. I'm gonna put the homework and the ball in your court. Do what you guys gotta do. Find out and research what you're intaking, how you're doing it, and the surrounding things around you, and do what's best for your health and your testosterone levels. I hope this helped. Stay tuned for the next video because I'm going to be covering a lot more information I think you guys are going to love. It will benefit your health day in and day out. Thank you guys. And call or text if you want to become a patient, 727-389-3220, and check out all the therapies that we offer at titanmedicalcenter.com. Appreciate you guys, and see you in the next video.